In this video, we'll be discussing the events of the cardiac cycle. Let's begin. The cardiac cycle is defined as a sequence of alternating contraction and relaxation of the atria and the ventricles in order to pump blood throughout the body. It starts at the beginning of one heartbeat and ends at the beginning of the next. The process usually begins as early as the 4th gestational week when the heart first begins contracting. It comprises of two periods: diastole, or a period of relaxation, and systole, which is a period of contraction. Assuming a healthy heart and a typical heart rate of 72 beats per minute, each cardiac cycle has a duration of about 0.8 seconds. Let's start with the first event of the cardiac cycle, that is atrial systole. It is preceded by the P wave, which represents electrical activation of the atria. Atrial systole leads to an increase in atrial pressure and is represented by the A wave on the venous pulse curve. It causes the fourth heart sound in ventricular hypertrophy, which is not audible in normal adults. The second event is isovolumetric ventricular contraction. It begins during the QRS complex, which represents electrical activation of the ventricles. Closure of the AV valves occurs during this time, which corresponds to the first heart sound. Since the contraction is isovolumetric, the ventricular volume remains constant. The third event is rapid ventricular ejection, during which the aortic valve opens and there is rapid ejection of blood into the aorta. Ventricular volume decreases dramatically. The C wave on the venous pulse curve occurs due to the bulging of the tricuspid valve into the right atrium during right ventricular contraction. During reduced ventricular ejection, the ejection of ventricular blood continues at a slower rate and ventricular pressure begins to decrease. Aortic pressure also decreases due to runoff of blood from large arteries into the smaller ones. Atrial filling continues and is represented by V wave on the venous pulse curve. During isovolumetric ventricular relaxation, the repolarization of the ventricles is complete and is marked by the end of the T wave. The aortic valve closes, followed by the closure of the pulmonic valve, which leads to the splitting of the heart sound. And this corresponds to the second heart sound. The AV valves remain closed during most of this phase. During rapid ventricular filling, the mitral and tricuspid valves open and ventricular filling begins. Rapid blood flow from atria into the ventricles causes the third heart sound, which is normal in children but not in adults. Reduced ventricular filling, or diastasis, is the longest phase of the cycle during which ventricular filling continues but at a slower rate.